Thank you for the opportunity to speak with you today. My name is Dr. Jennifer Jacobs, and I am co-founder and CEO of Connect Our Kids. I'm a West Point veteran, an Army veteran, and a nuclear engineer who spent most of my career working to counter nuclear terrorism. But 14 years ago, I read an article in Time magazine and realized that some of the work done in the counterterrorism space is similar to what's needed to help keep kids in foster care connected to their most important relationships. Both connect large networks of people and data to affect the future of someone in the center. The difference is just that one centers around a terrorist and one centers around a child. But while the national security space has multi-million-dollar software with data search and management capabilities, the foster care space was doing essentially the same work with sticky notes and Excel. That led to my co-founding Connect Our Kids as a nonprofit to recreate those national security tools to help keep kids in care connected to their people. We piloted our tools in 2020 and since then have served over 30,000 children. I'd like to tell you about one of them. Maddie was introduced to our software on her second day at her new job as a social worker in Ohio. Maddie's Gen Z, so it took her about 30 seconds to learn how to use the software, which was good because she'd just been handed her first case, 14-year-old Leon. It had been 2 years since Leon's adoptive mother had left him at a behavioral facility and moved out of state. Maddie understood from her training that she needed to find Leon's people, something no one had done in his entire 2 years in foster care. With the help of our software, Maddie was soon speaking with Leon's biological aunt, who, as it turned out, lived just 6 blocks away from where Maddie was sitting in her office. The aunt said, "Bring him to me right away. I had no idea he wasn't okay." Leon went to live with his aunt, and he got to meet his 2 cousins, his 2 full brothers he didn't know he had, and his birth mother. Maddie went to visit him a month later, and she said, "It's like he's always lived there," because Leon had found his people. While Chafee funds are often used on education, employment, housing, health, and financial capability, a 6th goal sometimes gets overlooked: meaningful, permanent connections with caring adults. That 6th goal, strong relational health, includes the concepts of belonging and identity, and it is the foundation that makes the other 5 possible. Without it, progress in education, housing, health, and employment is very hard to sustain. Humans need belonging and identity in a way that tangible supports cannot provide. There are some relevant parallels with the military. 1 in 4 foster youth meet the criteria for PTSD, more than double the rate of U.S. war veterans. Injured soldiers medevaced from their combat units can experience a dangerous loss of identity and purpose, even while receiving world-class care for their physical wounds. When youth lack the identity and belonging of feeling claimed and valued by their own, they face higher risks of homelessness, incarceration, unemployment, trafficking, victimization, and poor health. By contrast, when they have strong relational health, their outcomes improve dramatically. Relationships matter. They are the protective factor that makes everything else possible. But relational health is difficult to measure. You can count housing vouchers and job placements. It's harder to quantify belonging, trust, and connection. But across the military, education, government, medicine, we routinely invest in essential skills, leadership, judgment, resilience, that are hard to measure but foundational to success. Relational health belongs in the same category. And this matters for Chafee because when a young person ages out of foster care unsupported, their lifetime cost is roughly $500,000 per youth. For every 2,000 youth, that's $1 billion. Strengthening relational health is among the most cost-effective strategies available. I recommend issuing clear federal guidance that Chafee funds can be used for the building blocks of family connection efforts, and allowing a portion of unused Chafee funds to be centrally invested in relational health education so states do not have to build these costly initiatives alone. When we surround young people with people who know them, love them, and show up for them, that web becomes not only their safety net, but also their launching pad. Thank you for the opportunity to testify today.